Thank you for joining us today. My name's Kath McIntyre and I'm with the Australian Telehealth Society. But first of all, I'd just like to acknowledge that we're meeting today I am meeting today on the land of the Kaurna people of the Adelaide Plains, and I pay my respects to elders past and present, and I also extend that respect to all First Nations people with us today. Today I have Shaun Francis here from the Royal Flying Doctor Service. Hi Shaun, thank you for joining us. And Sharon Gannon from the Australian Telehealth Society. We thought it'd be a really good idea because Shaun did a fantastic presentation at the Success and Failures in Telehealth conference last year to get an update on your work. So Shaun, I'm going to hand it over to Sharon now, but perhaps you could just introduce yourself.
Sure, and thanks for having me along, both Kath, Sharon and the Australian Telehealth Society. So my name's Shaun Francis. I'm a doctor with RFDS Queensland section. I've been there for about 7 years. I'm a rural generalist by background, a fellow of the Royal Australian College of Rural and Remote Medicine. I live and work out of Cairns, predominantly around primary health, telehealth and retrieval. Current roles, I'm the Executive General Manager for Virtual Health and Clinical Informatics, and I oversee the virtual health service for RFDS across Queensland. Thanks.
Great, that's really exciting. Thanks, Shaun. So I'm a registered nurse by profession and I've been part of the Australian Telehealth Society for quite a few years, and telehealth is a great passion of mine. Unfortunately, I didn't get to actually see your presentation last year, but Kath and everyone have told me it's a fabulous opportunity to get to speak to you today. What I'd like first to do is to just get you to give a very brief summary of what the presentation was about, and then we'll go on and talk about what's been happening since. Okay?
Yeah, sure. So last year, the SFT 22, I presented a paper essentially around the evolution of RFDS telehealth. My role at that stage within RFDS was the state lead for the virtual health service. And I spoke broadly about RFDS as a federation. We have sections across Australia, noting that I work specifically for Queensland, and our service varies a little bit across the country. In particular, I focused on the origins of RFDS back to 1928 and how telehealth, and in that form, it was a pedal radio, and how it was a key innovation which really paved the way for RFDS expansion and to provide the services to rural and remote Australia. And our motto is the finest care to the furthest corner, and that really is captured in that. I also spoke about the RFDS medical chests, which a lot of people aren't really familiar with, although they might have heard of, and the vital role that they play across Australia and how it supports our telehealth provision. It's a really rich history for RFDS, and it's a fascinating story. I was honoured to be able to share that with the audience. And I concluded that presentation with a note about a new electronic health record that we were introducing, and briefly alluded to some of the other work that we had on the horizon.
Great, that sounds really good. I do remember first being introduced to medical chests when I started my telehealth role in 2000. We were delivering some nurse triage services out to Broken Hill, and needed to understand how outside of the city that the people had those chests. Yep. Okay, so what were the highlights for you of attending the conference and being able to talk to other people working in telehealth itself?
Yeah, so I think it's great to have a community spirit or a community get together in this space, given that I say it's relatively new, but as I said, we've been doing telehealth since 1928. I think the maturity around it, industry standards, accreditation, I think having a group that has a collective thought, vision and strategy for what this industry needs to be shaped towards is great. And having, I guess, because it's more specific than just digital health. Digital health has a lot of interest and there's a lot of momentum. Telehealth as a specific component of that. I think it's important that there are industry leaders and the collective group of people working in this space to help shape that, to get together and have a collective voice. And I think going forwards, and at the conference, it was a great opportunity to be able to engage with people who are making moves in this space, who already addressed a lot of the challenges. And I think I argue the concept of successes and failures is great in that this is an innovative space. Things are changing all the time. We, fail fast. There are a lot of things that we're going to do that may not hit the mark, but as a group and a collective, share those experiences and learnings. I think we'll get there much quicker and obviously the patients that we deliver on, and particularly from our perspective within RFDS, the rural and remote populations where we really want to make sure we can deliver this tech to. So it's also a great benefit for us to engage with people in other settings to see whether we can leverage off those techs and those learning experience to the populations that we serve. So great on all levels in terms of the presentations, but also the networking is key. It was great.
Right.
Yeah.
And have you continued that networking with anyone you met at the conference? Has that sort of carried through during the year? Have you been able to, or have you needed or wanted to make contact with others as a result?
Yeah. So yes, definitely. And I think part of the evolution, and it's been a bit of a rich year or few years, I think, in that space. A lot of digital health conferences, whether it's the MedInfo conference recently, or
Yep.
I think there's a general more community sense that going forwards, we're sharing the journey together. And as a result of that conference, more broadly, that those relationships have developed and matured, and being able to engage in that community, as I said, without the barriers of formality or the great opportunity to be able to develop those networks has really borne fruit through the rest of the year, through 2023, to be able to develop those relationships with a lot of industry as well as vendors and other stakeholders. It's been yeah, it's been good.
Oh, that's really good. Now, you've had some an exciting change to your role, I understand, this year. Do you want to tell us a bit about what you're doing now?
Yeah. So when I presented last year, I was the state lead for our virtual health service, so the operational lead for the telehealth service across Queensland. And I think partly in acknowledgement of this evolving space and the need to deliver on, consumer needs and where the industry is heading, I became the Executive General Manager for Virtual Health and Clinical Informatics at the start of this year, which is a new role for RFDS. We're shaping that, but as I said, it's accountable to the fact that the need to be able to interface between digital technology and clinicians, and to make sure that we have a finger on the pulse and evolve this. So I've been in this role since the start of the year, a lot going on, and I guess the role is maturing with myself in terms of what it needs to look like for us as an organisation and where we fit in the industry more broadly.
All right. Okay.
Yeah.
So now the other thing is that what we're thinking and planning of doing this year is, in the coming year, is some sort of Zoom-like gatherings, like little webinars and things. Would you be available, do you think, to join us for some of those or one of those?
Yeah, definitely. More than happy to touch base with that. And I think, as I said, as an industry, we need to make sure we move these things forwards. And RFDS has been in this space a long time. I think we have a lot to bring to share in this context because of some of the unique parts of where we work. Obviously, the rural and remote context, and also the nature of how we do telehealth is a little bit different, i.e. we do a lot of on-demand and acute work as well as the spectrum of care. So there's learnings from that space. And I think we're all facing similar challenges: interoperability, clinical data standards, and privacy, confidentiality, and some of those concepts. So yeah, more than happy to be involved.
Great, thanks. Well, that's really great. Thank you. Okay, Kath, you ready?
I am. Shaun, I'd like to hear a little bit more about the work that you're doing in the last kind of 12 months, how things might have evolved for you in how you work.
Yeah, sure. So it has been a very busy time for lots of reasons, and I think everyone in the digital health space can probably say the same thing. One of the key pieces of work that I've been involved with since coming into my new role has been around digital health strategy. And again, I think good to get definitions and terminology. All right, we referring to digital health as the overarching infrastructure and those things that help support. We're also working on a virtual health strategy, which is more specific to telehealth and telepharmacy and those things. The digital health strategy has been, I think, fundamentally a piece of work that has really opened my eyes up from a clinician's perspective, and what the large focus has been around what the requirements for an organisation are to be able to pivot or to deliver virtual health or digital health solutions in a healthcare setting, because it's not as simple as just flicking a switch and starting to deliver these services. And we've been delivering telehealth for a long time, but having the infrastructure in place around things like, as I said, data analytics and those sorts of things are fundamentally required to be able to expand and leverage off a lot of the technology. So most of this year has been around shaping our digital and technology capability in the digital health space as compared to more of a digital support for a health organisation. So that's been a significant piece of work and taken up a fair bit of my time, a big learning journey for me to have that interface between the clinicians and the IT. As an example that's fallen out of that, and I've spoken to the Australian Institute of Digital Health presentation sometime last year, we're a complex health service provider. We provide dental care, mental health, primary health, telehealth, and aeromedical retrieval services. And as you'd probably imagine, we have therefore something in the vicinity of 6 different instances of medical records. And although they're relatively unique in what they need to include and the requirements for them, it's no longer really acceptable that they don't talk or are interoperable, and that we need to be aware of the touch points for patients. So I think like a lot of healthcare organisations, we're looking down the barrel of SNOMED CTAU standards, FHIR resources, and the future, both what we want as organisations and what patients are going to expect, and including myself as a consumer. And so building those supports in and looking at how we use our records going forwards has been a key player, a key component of that strategy. And I'd just call out that the telehealth service amongst those services is the one that joins them all together. It's pivotal in how those other services correlate, collaborate, and actually at the touch point that a lot of those services have in the middle. So we will basically, within our strategy, help drive those services into interoperability standards, and telehealth will be the medium for which that sort of occurs. Now, so as I said, it's a big challenge, big piece of work, and that's a big part of the first part of this year. In follow-up to presentation last year at the conference, I mentioned our electronic health record, and I think it's worth noting that we implemented a electronic health record, a bespoke telehealth platform called Mantle, and that the name alludes to our what we're known for as the mantle of safety in these regions. And it was an electronic record from paper. So it was a transition process where we had a paper system capturing our telehealth consultation records. We converted completely over to an electronic record July last year, and now more than 12 months into that, it's been a really successful rollout, a really successful program. And I'd just call out the fact that we've had a really strong engagement from the clinicians. Meg O'Connell, who's one of my direct reports and the telehealth lead, was really instrumental in that. And Dimity Holiday, who's our IT team, have really meant that platform has been successful. And I would say a bit of a seamless transition when we anticipated a few hiccups, as you would with an electronic record. But it was testament to the change management concept, engaging with clinicians, and that interface between clinicians and IT, which really meant a successful rollout. And we're starting to see, well, we already saw from day one, but we're starting to reap some of the benefits of having an electronic record. And that's great. It means we can more data analytics, and we can start to shape and inform stakeholders, etc. So we're in a stage now, because of that transition, that we can now evolve and develop those services that come out of it, including things like the medical chest. I guess just a few other quick points if I had time, but the other probably big pieces of work, we're looking now at a virtual health strategy. And again, just to reiterate the terminology, we're referring to that as around our telehealth and telepharmacy. And the telepharmacy for us is the RFDS medical chest. So we're at a stage now where we're looking into the future. We've built the foundations from the digital health architecture perspective to now look at absorbing or looking at new technology and how we can bring that in. And I always give the caveat when I talk about tech within RFDS is our remit is for rural and remote or isolated vulnerable populations, and we're very careful about implementing any technology which creates barriers to access. And that's why I wouldn't say we're slow on the uptake, but we're very cautious and considered, and we always need really robust fail-safes. Some of our patient populations don't have access to high-speed internet. Some of them don't have access to any internet at all. Satellite phones is a relatively common way that we engage with people. So any tech that we implement has to be looked through those lenses. And that's why this strategy will do that with a forward-looking, innovative blue sky approach. But however, we know very much so that anyone behind, because our populations by their nature are vulnerable and don't have access to a lot of infrastructure. So that's an exciting time for us because we've built some of the tech in the back end to be able to expand that. Going forwards, it's about consumer engagement, looking at those challenges and barriers and trying to innovate around it. Things like, the low orbit satellites, Starlink and those sorts of things have opened up opportunities for us that didn't previously exist. So we're pretty excited to try to capitalize on those opportunities. And the last thing I'd probably say is around our telehealth workforce in the last 12 months has changed as well. We've evolved it to a dedicated service where previously it was a extension of other clinical services to provide that telehealth service. Now we've stood up a dedicated role. So that person on a shift is predominantly responsible for incoming telehealth and potentially some outgoing scheduled telehealth as well. So that's a evolution for us, and it opens up a significant number of other opportunities, including most recently we will have a contract with North Queensland PHN for commissioning service for the general practice after hours services, which is exciting for us. Keen to expand upon that, and what it's done, it's allowed us to deliver some of those really essential services to regions that don't have access to anyone else in those sort of unsociable hours, or when there's no one with a physical presence in these locations. So that's a bit of a snapshot, really, because there's a lot of other work that you'd imagine that underpins that or falls out of that. But that's probably some of the major points within the last 6-12 months.
I think you've been a bit busy.
Yeah, it sounds like it. Just such important work.
Phenomenal. Oh, it sounds phenomenal. Oh, really? Please try and come to the conference.
Yeah, I'd love to
hear more about this. This is so important. It's such a challenge, but that interoperability, engagement with clinicians, new roles for people. I'm assuming the work you do with the Far Northern PHN, all of that's just critical to the well-being of so many people and the well-being of telehealth as well. I'll be selfish there and throw that in. And consumer engagement, you mentioned that just briefly there at the end. I would expect that, given the long history of RFDS, that there's been consumer input into almost everything you do, because those people are so vulnerable, as you say, because they're so far remote.
Yeah, and look, we're formalising that more than we have previously, but it's essentially any change or any direction of service delivery for us, we have to do based on what our consumers need. And that's kind of been our model from day one. I often sort of describe our service as the service where there's otherwise none. So if there is established infrastructure, we have less need for our services because the other services are there. However, those patients who predominantly engage with us, there are no other alternatives. So to make any change in either the frequency or the model, we really need to make sure, and we do this, we make sure that we consult. And again, because we're the services on the ground, we have a great relationship. Some of that is informal and some of it is informal of how we help shape. So I think consumer engagement going forwards, and I know I'm probably preaching to the converted, but I think this is going to be what drives a lot of the uptake of telehealth and the broader virtual health. And I would caveat that simultaneously by the fact that that will also mean that it opens the doors for disruptive organizations or disruptive technology, if you like, which has the potential to alter the landscape and modify how services are delivered. So we're conscious of that as well, and making sure that we advocate for those consumers in the rural remote context who may be impacted by a technology or a service or something similar that might evolve elsewhere but have flow-on effects to our population. So yeah,
fabulous. Thank you. Good.
We'd love for you to come back and talk to us again. I mean, there's so much to talk about, and you're just doing such amazing work. Thank you.
Yeah, no worries.
Great. Good. All right. Well, thank you, Shaun, and thank you, Sharon. Thank you for giving us your time today. And if anyone would like to know more about the Australian Telehealth Society, you can contact us on aths.org.au, or if you would like to know anything more about the Success and Failures in Telehealth Conference that's going on in November this year. Thank you, Shaun, so much. Thank you, Sharon. Love to speak to you again.
See you later. Bye, Shaun.
Okay, thank
you.
you.
Okay.
Thank you.
Bye.